Tennessee Oncology is committed to providing the highest quality of care, and we're participating in several value-based care programs. Our success requires that we reduce emergency room and hospital visits.
The pilot program at Tennessee Oncology focuses on enhancing our care coordination efforts to improve the overall quality of care for our patients and reduce their cost. Through data analytics, we identified that we have a certain population of patients that are at higher risk due to certain comorbidities such as COPD, CHF, and diabetes. By developing internal care management algorithms, our care coordination team can use those to better manage the patient's treatment and the comorbidities that they face.
With this pilot program, we found this really exciting technology where we can get data from the hospitals here in the state of Tennessee. We can take that data, load it into our database. Then we can go in and we can look at all of our admissions in the emergency room and inpatient admissions, and we can leverage that data with our navigators and our care coordinators, and we can do proactive interventions with our patients.
These patients have cancer, and the last place they want to be is the hospital. So if we can prevent that, then we're doing really good things.
In the end, this project's going to most benefit our patients, because hopefully we can find interventions to help keep them out of the hospital and at home, spending that precious time with their loved ones instead of admitted into a hospital.
Now that we have this data that we've never had before, data that we've been chasing for years, ever since we entered the OCM, we can take that data, we can give it to our navigators. They can use that to reach out to patients after they've been discharged. We can bring them in right after discharge, have them see their physician, and then we can make sure that we can avoid things like readmissions or future visits to the emergency room.
This platform will allow us to evaluate trends and patterns in the data and change our approach from reactive to proactive to better serve our patients.
Our success requires that we reduce hospital visits and emergency room utilization. As we work closely with hospital staff, we will strengthen our partnerships with these organizations.
So the great thing about this project and data is it's going to help us benefit our patients by keeping them at home, but also help us in our value-based care efforts by keeping people out of the hospital, which is expensive. And when we're accountable for those costs, reducing hospitalizations helps us succeed in those models while also improving quality of life and reducing financial toxicity for our patients.
As all of you other innovators are looking to make headway in this value-based care space, one thing I would say is don't give up. What you're looking for is out there somewhere. You just got to keep looking. We've been chasing this data, this hospital data, for so long, and we finally found it. It's opened up so many doors for us that we're still trying to figure out how we're going to navigate it. It's actually a really exciting time for us at Tennessee Oncology.
If I had to give advice to other innovators, I would say focus on your mission and determine what's of most interest to you.